Hi, my name is Dr. Lee. I'm a reproductive endocrinologist and an infertility specialist at Maria Fertility Hospital in Ilsan, Korea. In today's episode of Doctor, I have another question. I wanted to discuss frequently asked questions from couples who are trying to conceive naturally. In order to provide sound answers objectively, I will answer each question based off on a review article published in the American Society of Reproductive Medicine in 2017, which focused on the methods to increase the success rate of natural pregnancy. After checking the ultrasound and giving an explanation of the exam, I am always flooded with questions such as, when is the best time to get pregnant? Or, when should we have intercourse? What time should we have sex? How many times should we do it? Can I drink alcohol or coffee? Or can I smoke? Or is it okay to use lubricants? Honestly, not a day goes by where I'm not asked these questions. And today, I'm going to try to focus on these questions. The first question: Doctor, is something wrong with me? How do I know whether I'm fertile or infertile? Infertility is defined as not being able to get pregnant despite having frequent unprotected sex for at least a year. Those under 35 are diagnosed as infertile after a year of trying. For those who are 35 years old, the time frame shortens to 6 months. Although the diagnostic criteria seems to be clearly defined, I personally think that this is a somewhat vague standard, simply because what is considered normal to one case can often be interpreted arbitrarily for another. Due to such issues, I often contemplate whether not one should indeed be diagnosed as infertile. Additionally, there are times when a patient does not think they are infertile, when indeed they severely are. For example, there was a newlywed couple who were married for 3 months, and they were 43 years old. They came to see me in order to ease their worries and continuous naggings of their peers. The couple dated for 10 years before getting married, and during those years, rather than using a sure form of contraception, they used the pull-out method, believing that that would be a sufficient method for birth control. I immediately recommended that the couple go under IVF program, in vitro fertilization. According to Kipley's 1996 published Types of Contraception, the failure rate of couple who try to get pregnant after practicing the pull-out method for a year increased from 15% to 26%. There are some research reports even higher failure rates than that, and this is 2 to 3 times more compared to the 7% increase of failure rate who those use the birth control pills. For that couple's perspective, they can rightfully think we've only been married for only 3 months. That's not long enough to be recommended for IVF. However, it is important to note that their attempt to get pregnant should actually be calculated from the biological feasible point, not when the two consciously decide to become pregnant. Contrarily, there was a case of a young bride in her mid-20s who visited my clinic crying uncontrollably and worrying because she was failed to get pregnant only after 3 months of following the ovulation and dates calculated from a smartphone app. In conclusion, it is important to objectively determine whether or not you might be infertile. Then, it is crucial to seek professional consultation to determine the severity of your state in order to receive the best and the most appropriate treatments. Generally, the chances of conception are highest in the first 3 months of attempting to get pregnant. Rather than to think that the success rate falls for each individual after 3 months, this might come off a bit unfair to our female viewers, but when a woman reaches the age of 35, the chances of becoming pregnant begins to plummet. As you can see in the graph, the success rate decreases as one gets older, obviously. The same applies to men who reach over 35 years of age, but not a significant decrease compared to women. Unlike women, the age at which the pregnancy rate falls sharply due to age for men is around 50 years old. For women who are 35 years old age, it is a crucial factor for a successful pregnancy. This is the reason why they are given such a short time frame of 6 months before they are diagnosed to be infertile. Doctor, we are attempting intercourse after being diagnosed as infertile. How often should we have sex to achieve a successful pregnancy? It is true that there are many misconceived notions about pregnancy due to myth and superstitions, as well as unscientific claims falsely made by others who have succeeded in getting pregnant. And I've seen all sorts of cases, but there are still times when I'm taken aback by certain patients who try to get pregnant based on an appalling myth or very, very incorrect information. The most common misconception is that the belief that the longer the sexual abstinence period, the better quality of semen. However, according to the reports made in 2017 by American Infertility Society, the opposite is true. When I say this from my patients, the majority admit that they had no idea. The AIS reports that shorter abstinence period improves the quality of semen. Additionally, for men who are lack in number of sperm, it may seem logical that they ejaculate sparingly, but a higher quality of sperm and motility is observed when one ejaculated every day. Despite the rumors, when an abstinence period exceeds 10 days, the overall quality of sperm index deteriorates. Therefore, if possible, it does not overwhelm couples, and I cannot emphasize this enough, if it does not overwhelm couples, having sex every day can be quite beneficial to a successful pregnancy. It is reported that the pregnancy success rate is around 37% for couples who have sex every day during the cycle, 33% for couples who had sex every day, every other day, which can be decreased to 15% for couples who have sex once a week. However, keep in mind that despite the statistics, obsession over these numbers or excessive force to have sex every day can also lead to many side effects. Then, when should I have sexual intercourse in order to increase my chances of conception? There is a high chance of conception during the 6-day time frame, which is 5 days before ovulation. Unlike what most think, the day of ovulation is not the only day of possible conception. Your best chance of conception starts in 5 days before ovulation and even up to the day after ovulation. And I'm pretty sure there are many who are surprised by this, but generally speaking, conception does not take place simply because the genital parts of a man and woman meet. The conception actually takes place when the gametes of both men and women unite. When semen is released during the vaginal intercourse, the sperm cells enter the vaginal canal and they may survive up to 5 days inside. Having intercourse during this time frame increases the chance for a sperm cell to meet with the egg to fertilize. Therefore, it is considered that you are most fertile 5 days before ovulation, and since the egg survives for 12 to 24 hours after ovulation, you can still consider fertile on the day and the day after ovulation day. During your most fertile days, keep in mind that sexual intercourse 2 days before ovulation guarantees the highest chance of conception, because the ovulation mucus can be observed at the time, and however, it is difficult to confirm the accurate day without an ultrasound examination at the hospital, which is why it is always encouraged for couples to have intercourse more often during this time frame. I really hope today's contents was a little helpful to you. In next episode, we will discuss how to check your ovulation and the relation between the chances of conception and the sexual positions, orgasms, the vaginal lubricants, nutritional diet, weight, smoking, and drinking, alcohol and caffeine. If you have any other questions, ask down below in the comment section, or leave a message in the discussion room, and I will answer them to the best of my ability. To all the couples who are suffering from infertility, I'll be right by your side until the day all of you become parents. I'm Dr. Lee, your infertility specialist, and I hope you are successful this month. Thank you.